Hello, I'm Dr. Ramya Narayanan from Strong Roots Dental. I have my colleague, Dr. Saloni Trivedi, here with me today. So we are going to talk about dental implants and answer some of the most commonly questions you guys might have. That's a very detailed question. There are a few medical conditions that I wouldn't necessarily say disqualify, but probably not allow that person to get dental implants at that point in time. It could be uncontrolled diabetes. It could be periodontal diseases, right? Or it could be if a patient is a chronic chain smoker. So these are all things that can affect the health of the bone, the health of the tissues, so which can cause failure of dental implants. So those are conditions where, that's something to be discussed with your dentist, where they will advise you to either get some kind of help and get, the conditions under control before we talk about placing dental implants.
So that's a good question. I mean, we got into this a little bit, but essentially the benefits are that you're not leaving a space open and you're not, having that open to things like I said, bad shifting of teeth into positions that we don't want them to, or just lack of teeth, meaning, less efficiency in chewing, or lack of teeth, meaning, not an aesthetic thing.
Sure.
So the benefits there are just having that part in your body that your body accepts as a natural tooth and restoring back your function. Risks wise, I mean, studies show that 90 to 95% of dental implants last 10 years or more. So we're not talking a very big risk. Of course, at the end of the day, it's always possible. But that's all why we always are big advocates of making sure the home care is ideal, making sure people are coming every 6 months so that the risks are low.
Sure. And of course, there always can be some amount of rejection that can happen, right after placing the implant. So that's why it's very important that you come back to your dental office within the first 6 months of placing your dental implant. So that way x-rays or whatever needs to be taken will be taken. And if something feels is not right, it can easily be, you can go back and correct it. So you will first go in for a consultation, and assuming you're missing a tooth, then the dentist will go ahead and to get some x-rays taken, get some CBCT taken, just to make sure the bone, the height of the bone, the width of the bone, the density of the bone is correct, and whether you would be a good candidate for a dental implant.
So like you said that first step is that consult, getting to make sure that you are a candidate, you have the right amount of bone, or if we have to do something to get the right amount of bone, then we will schedule you with our surgeon to get that actual implant placed. That appointment kind of depends on how many, where, things like that.
Sure.
And then if we're talking, 1 or 2 implants, 3 to 4 months later, we'll let that body really heal the implant and accept it as its own, and then put that crown over it. So usually just a day or 2 after the implant, there could be some soreness because it is a surgery at the end of the day. Afterwards, once that 2 or 3 days goes by, no, you probably won't even know it's there. And then 3 months later, like we said, we expose it again and just pop that crown on top.
Right. So generally, one of the questions my patients ask me is, you said the healing period for an implant is 3 to 4 months. What it actually means is it's not that you're going to be in pain. It just means that it takes that long for the implant to integrate with the rest of the bone.
Right.
And that process takes about 3 to 4 months. So as far as pain is concerned, like Dr. Trivedi said, you're probably going to have a little bit of soreness the day off and the next day, but nothing after. Again, it depends on the kind of procedure. I mean, if you're getting a single tooth replaced with a dental implant, or if you're getting multiple implants placed, or if you're going in for a full mouth reconstruction or full arch dental implants. But typically, for an ideal scenario where the patient is missing the tooth and the bone height is good and the bone support is good, the density is good, I would probably say about 45 minutes to get one single dental implant placed.
That's a good question. So what I think, in my opinion, the only thing that might be just a little bit painful is getting numb, that light, tiny pinch of the needle. Once that kicks in, you should not be feeling the rest of the appointment. It might be a little pressure, a little water, but nothing painful. And then like we kind of talked about before, the 2 to 3 days after could be a little sore, but the actual pain should not be there, especially because we give you certain medications to kind of control that.
Sure. So Jerry, my patients ask, can I go back to work the next day? Can you? Absolutely. In all honesty, it depends on the kind of work that's being done.
Right.
So if I tell my patients, listen, if you want to go back and go back to work, you absolutely can. But if your work involves talking in front of a crowd or addressing a crowd, maybe not. Generally, studies show dental implants do last anywhere between 20 to 30 years. Right? It depends on a lot of factors, but can it last for the rest of our lives? It can. It may not.
So generally, in the state of New Jersey, we've seen that the average cost of an implant is anywhere from $5,000 to $7,000. Obviously, not counting what your insurance could help you with. And in terms of financing options, that's something that there's many, and that's something that we can help you with when you come in.
Sure.
And we can apply for.
See, obviously, it depends on the dental plan that you choose. But from what I have seen, yes, most dental insurances do cover a portion of dental implant. Again, the best person to ask would be, go to the dental office and ask the insurance coordinator. I'm sure they'll be happy to help you.
So I hope that helped. I hope we were able to answer some of your questions on, dental implants and the process. But I'm sure if you have any other questions, please do just give us a call at Strong Roots Dental, and we'd be happy to help you.
Thank you.